Today, we're going to talk about the 13 signs that your body is deficient in nutrients. A deficiency of nutrients doesn't necessarily mean that you're not consuming this from your diet. There's other reasons why you might be deficient. One would be lacking your stomach acid. If you don't have enough acid, you can't absorb minerals that well because certain minerals need a certain pH to be absorbed, especially things like calcium and iron. Another way you could be deficient is there's a problem with your gallbladder, or you don't have a gallbladder, or you're deficient in bile. So then it doesn't matter how many fat-soluble vitamins you take, like vitamin A, D, E, K. Without that bile, it can't go into the body. Another reason why people are deficient is they have damage in their gut lining. That's called a malabsorption problem. And the surface area of your small intestine is just not receiving nutrients. Maybe you had a history of a lot of antibiotics or some infection, or you ate a lot of junk food, but that small intestine is needed to absorb at least 90% of all your nutrients. Another reason why you might be deficient is that you're eating refined carbohydrates or refined sugars or alcohol, or you're taking medication. Like, for example, metformin will deplete vitamin B12. And one other way you might become deficient is stress. Stress will deplete zinc, B1, calcium, magnesium, and many other nutrients. All right, that being said, let's dive right in. The first sign I'm going to talk about is fibrocystic breast. So there's these little cysts that are developing on the breast or the ovary. That is a classic iodine deficiency. When you're low in iodine, you don't have the buffering function of estrogen anymore. Without iodine, estrogen can go too high, creating cysts and other problems. I mean, you can even have cysts in the thyroid. So iodine is a really good trace mineral to help regulate that level of estrogen. And sea kelp is one of the best sources of iodine. All right, number 2, dry eyes. That is a classic vitamin A deficiency. Without vitamin A, your mucous membranes dry up. And this could also occur in your mouth. You can have dry mouth or dry eyes. The best source of vitamin A comes from animal products, not plants. All plants have the precursor to the active form of vitamin A called retinol. So this carotene has to convert to retinol to actually have it work. And unfortunately, you only really get about a 3% conversion rate. So if you're not consuming animal products, you may easily get a vitamin A deficiency. All right, next one, red cheeks, okay? Like rosacea. That is usually a digestive problem. There's an imbalance in microflora in your gut, and that's also creating an imbalance of microflora on your skin. But as far as a nutrient deficiency, that would be a lack of B vitamins because your microbes make B vitamins, and B vitamins protect the skin, especially vitamin B3. If you're deficient in B3, you're going to get all sorts of skin problems, from dermatitis to all inflammatory conditions in the skin, acne, all sorts of things. But if you see someone with red cheeks, suspect that there's something going on with their gut and they need to take a good probiotic or consume foods that have the naturally occurring microbes like sauerkraut, kimchi, or even kefir. All right, the next one I'm going to talk about is a combination of 3 symptoms: shortness of breath, looking pale, and fatigue. This is classic anemia, but the key nutrients to overcome anemia is iron, but also B12 and folate. There's an actual genetic condition. This is another thing I forgot to mention at the very beginning. You can be deficient in a nutrient if you have a genetic mutation, which nowadays they're testing your DNA and they're finding all sorts of weaknesses within your DNA. And there's a certain gene that regulates activating folate and B12. And if there's a problem with that gene, you're going to be anemic. You're going to have a lot of problems unless you take larger amounts of the natural form of B12 as well as folate. And just as a side note, you can also be anemic if you have problems with your stomach because you don't produce hydrochloric acid, and if you have some type of gut issue that you just can't absorb these nutrients. All right, number 5, corkscrew hairs on your skin. Now, what is that? If you look closely, sometimes you have to have a little magnifying glass on your skin and you see that these little hairs are going in like little corkscrew shapes, okay? And there's usually going to be a red dot where that's originating from. That's one of the big symptoms of a vitamin C deficiency. Now, to correlate that, there's other vitamin C deficiency signs as well, like bleeding gums, like extreme fatigue. And what's interesting is the chemistry of vitamin C is very similar to the chemistry of glucose, sugar. So if you are consuming glucose and vitamin C at the same time, guess who's going to win? The sugar, not the vitamin C. And so you're going to block the absorption of vitamin C. So people that consume a lot of sugar usually are showing signs of a vitamin C deficiency. But just remember, the corkscrew little hairs on your skin is a classic vitamin C deficiency. If you're going to fix this problem, I would highly recommend not to use the synthetic version of vitamin C, ascorbic acid. I would use a whole vitamin C complex that actually comes from like a food or an herb. All right, number 6, belly fat. Now, this is not necessarily just a vitamin deficiency, but there is a very common deficiency involved with belly fat. You see, belly fat occurs when the liver is fatty, and you have this spill off of fat from the liver around the organs in your abdomen, giving you this protruding of fat. So one really good way to get rid of fat off your liver is to start taking choline, which is in the family of the B vitamins, and of course, do the ketogenic diet. You can literally remove 50% of your fat off your liver within 2 weeks by doing a ketogenic diet. All right, number 7, if you're craving ice, okay, or you see someone chewing on ice, classic iron deficiency. They need iron. Realize that there's 2 forms of iron. You have the iron that's very absorbable. That's called the bioavailable iron or heme iron from animal products. And then you have the non-heme version of that, which is more difficult to absorb in plants, like, for example, spinach. So if someone is just eating plants and not eating any animal products, potentially they could have an iron deficiency, and they may start chewing ice. They also may develop anemia. All right, number 8, scaly, flaky skin, okay? Sometimes it's like right around the nose. Sometimes it could be anywhere in the face. The face could be slightly oily, but there's this scaly, flaky skin. Classic omega-3 fatty acid deficiency. That person needs to start consuming more cod liver oil or fish oil and start to avoid omega-6 fatty acids, which is the corn oil, the soy oil, all these fried foods that they serve at restaurants. All right, number 9, loss of taste or loss of smell is mostly a zinc deficiency. It can also be related to a virus destroying nerves in your sinuses, but if we're talking about nutrition, it's going to be a zinc deficiency, and the best source of zinc is shellfish, like oysters. You can also get zinc from red meat as well as liver. All right, number 10, you have like this symmetrical skin rash that is in the lower legs or the hands, or even a rash that looks like a necklace. This is a pellagra symptom, which is a B3 deficiency. And if someone is consuming way too much corn products, which actually is in a lot of foods, corn chips and tortillas, and even high fructose corn syrup, you can develop a very severe B3 deficiency because there's virtually no B3 in corn. So if you eat a lot of it, you become deficient in that nutrient and you start getting dermatitis. But it will show up in this symmetrical pattern of like your feet or your lower legs or your hand. All right, number 11. Let's say a person has a red, swollen, glassy tongue, okay? That is a B12 deficiency. Now, again, there's other factors with B12, like you can have a genetic mutation creating a problem with B12. You can have a problem with your stomach. You can have a lack of hydrochloric acid. You can have an issue with your small intestine. You just don't eat animal products because you can only get B12 from animal products. All right, number 12, numb or burning feet is a B1 deficiency, usually coming from either a high carbohydrate diet or the person's a diabetic, and this extra sugar is depleting B1, and then your body can't make something called myelin, that surrounds the nerves, and you start getting weird neurological symptoms on the bottom of your foot. It could be numbness, like tingling, burning, or pain. That is a B1 deficiency. What you need to do is take a powerful form of B1 in a fat-soluble form called benfotiamine, and that will get rid of that symptom, and then you'd have to change your diet as well. All right, 13. If your eyes start crossing, it's not being controlled by the muscle, and you may see this more in younger children, but it can also occur with someone who drinks a lot of alcohol or eats a lot of junk food, because this is an example of a B1 deficiency. Now, if you like this video and you'd like to learn more about nutritional deficiencies, I created a very popular video entitled 23 Signs Your Body is Deficient in Nutrients. And I put that up right here. Check it out.